This program is a paid commercial announcement and in no way represents the views of WPH.D or its management.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Good morning and welcome to another beautiful day. We figure we'll get you healthy in this hour and then you can go out and enjoy, right?
That's
the way it works.
That's the point, John.
There you go.
Everybody better get out and walk around a little bit, not too much longer with weather like this.
That's right. So take advantage of it.
That's it.
We're happy to be here and we're happy to have you join us for our weekly get-together. We call it Health Watch. Every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. You heard the man say, Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, Marlton, New Jersey. Dr. Molly is here, going to talk about what they do, why they do it, and how they do it at Innovative Medical. And, of course, we always welcome your participation. If you have a question for Dr. Molly or you have a medical challenge you want to run by her, 855-839-1210 is the number here, 855-839-1210. And, again, it's Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. I wanted to start, Dr. Molly, by posing a phrase. Innovative Medical Associates is unique. How?
Because we are a cooperative of like-minded healthcare providers in that we all operate from my home facility, which is Associates in Preventive, which has the license. We are a licensed facility in New Jersey, and that entails primary care. And so we offer full primary care, which could be, as simple as coming in for a virus other than Corona. Okay, let's because we're going to talk about that again today.
Yeah, before Corona, there used to be a lot of viruses.
There used to be other viruses, right? And we can help a patient with that with an antiviral prescription, and or if it's bacterial, we can give you a prescription for whatever you need. If your blood pressure's high, we can do that. If you're on a cardiac med and you need your cardiac med, we can do that. But the philosophy is that we want to use the least amount of pharmaceutical to correct your problem, and we do that by augmenting with natural substances, vitamins, minerals, things you can find in the health food store, amino acids. But the unique part of this is our facility can deliver them by hydration.
So if you come into Innovative Medical and let's just say you have a cold and,
sure.
and there's going to be a prescription and your
Fine.
docs can do that.
Right.
But then you're going to add something else.
I'm going to try to find out the underlying reasons why you have this challenge, and is there something we can do on a functional level to improve your quality of life and reduce maybe some of your medication. I think that's what separates us from all of these spas that claim they're doing all these wonderful IVs. Oh, you want to enhance your immune system. You have a post-drunken party. You want to come in. All of those. That's great. But our philosophy is actually one to really, really help you augment your health. And I think that's really the difference. We are concentrating on improved quality of life and improving your health and your quality of life.
You've often mentioned spas. You are a licensed medical facility, as you say.
Exactly.
So there's a difference.
Huge. Talk about the economic difference. There's a huge difference. I mean, I have a medical waste generator. We were just talking about that number because you don't think, what am I going to do with all of the paraphernalia that's left over from using
that's right,
hydration.
yeah, that's right.
I mean, we actually follow all kinds of regulations. I'm a stickler on infection control, and I can thank my, God bless, my nurse, seasoned nurse, Barbara. And, there are many, many reasons why a facility is probably a better place to go for these kinds of things.
So the hydration supplements.
That's right.
What you're doing.
Exactly.
And you use that in lieu of perhaps maybe prescriptions.
Sometimes we'll give you a prescription depending on what you're coming in. Obviously, listen, John, I run the gamut of people who just want to be well. I have a group of people who came in just recently who were athletes. and they were just trying to tune up for some type of program that they were doing. So, I mean, we run the gamut here. But the one thing I will tell you is that in doing so, I have protocols that have been around for 25 years. It's hard to believe. And we look at that and we search out the best for a patient. And by the way, my protocols are not etched in stone either. That's something that came up just the other day. Oh, well, you have a protocol for cancer support. Well, it's not the same for everybody. So everything's individualized at our clinic.
Which we always bring this up, and it happened again this week. Someone was sitting there talking to me, and she said, well, what are you here for? And I mentioned it. How long you been here? I said, 20 years. What? But her bag was different than mine.
But you know what? I want people to get off the bags because, what brought you here? What brought you to us? If you have a traditionalist family doctor, let's say, or you're being treated from an outpatient clinic, would you be there for 20 years? Probably.
Yeah.
Probably.
Yeah, you're right.
And you know what? You've had a healthier 20 years because of it.
Yes, that's true.
So
that's
let's
true.
talk about that. And that's what we see for most of our people.
So everything really what you do for every patient is customized.
Exactly.
In other words, if I have an orange bag and the person across from me has an orange bag, it's not the same.
No,
Okay.
no. And that's the key. I always tell them, please don't worry about the rainbow, okay? Let's worry about the pot of gold.
That's right.
All right, for you. That's the point.
Yeah. But the other question, and I know you get it every consultation.
Oh, yeah.
Dr. Molly, does this really work? I mean, I heard you talk about it on the radio. And I mean, does it work?
Well, here's the thing. Come in, talk to the patients. They'll tell you whether it works or not. Listen, some days are diamond, some are stone, but I can tell you the overall outcome for a patient is ultimately good. And that's what we want to do. We want to arrest some of the symptomatology, and we want you to have some quality of life. What's the point of coming in and you're dragging yourself and you have palpitations and you have this and you have that? Well, have we improved some of your symptoms? The answer is that's what I want to know.
Right.
What have we improved? And can I improve? Listen, it's not holy water. This isn't magic. Don't I wish that my docs were magicians? They're not. But we definitely listen and we hone in and we try to really improve your quality of life when you come through those doors.
How many times did you have a patient who comes in? I mean, this has probably happened 100 times, and I've heard you say it. Dr. Molly, I went to such and such doctor, and he said, there's nothing more we can do for you.
I hate that. I hate that.
I know you do. And how many times have you then treated that person and they feel better?
I don't treat, but I certainly assist in the
Exactly.
treatments of these patients. And I can tell you that indeed I have seen people improved exponentially, even when they were told. And here's the thing, John, what's improvement? Is for some people, improvement is just playing with their 5-year-old grandson. For other people, it's about traveling. For some other people, it's about, I'm able to finally take a breath while running the vacuum. That's improvement. So your quality of life and my quality of life and everybody's just trifling different. But overall, do we improve your quality of life? That's what we're all about.
And that's really that's the bottom line.
Exactly. And I can also show you improvement then in laboratory data. But that's secondary to what I really try to do. And you know what? Read the new book. It's a very easy read. It's a simple read, right?
Yes.
But that tells you about what? Improvement in quality of life for each one of the people that we highlighted.
You wrote some really, again, the book is God's Ingredients, TOO, My 30-Year Journey in IV Nutritional Medicine. There's some stories in there that I didn't even know. I didn't even know about.
I know.
And it
Quietly,
was like one of the stories was like, this was a 10-year situation,
right,
where this guy was.
It was a mess.
Exactly.
A mess.
And so I guess the point is, does it work? That was the original question.
And yes, it does.
And I have to tell you that I can tell a lot of times, like where I feel maybe a slight cold coming on. And you can feel that something's fighting it.
Right.
At least that's what I feel.
Right.
And it's like it goes away quickly, as opposed to years before I met you. You get the cold and it's 2 weeks and it's runny nose and all this stuff.
Look,
and so I just feel like that
Thank you, John. But, as I say before, this isn't holy water. We've got to do some things outside, too. And we will help you do that. We give you a list of supplements, and we'll review that list every 6 months or so because it can change depending on what's happening with the blood work. That's the other thing. I mean, do we try to really be on top of our patients? The answer is yes. Yes.
All right, we're coming up on our first break of the morning. Our show is called Health Watch. We're here every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here. She is the Ph.D. doctor and the executive director and the founder of Innovative Medical Associates located in Marlton, New Jersey. You have a question for Dr. Molly right now? You have a medical challenge, or you just want to ask a simple question about what you might be taking? 855-839-1210 is the number. 855-839-1210. With Dr. Molly Fantasia, I'm your host, John DeMasi. We return. More of today's Health Watch after these words. And we're back here on Health Watch, and as always, operators are standing by at Innovative Medical Associates. All you have to do if you want to get more information, you want to ask a question, or you're a little bashful, you don't want to come on the radio, well, just call them, 856-489-0505, 856-489-0505, Innovative Medical Associates, Marlton, New Jersey. Like I said, you give them a call, and you want to sit down with Dr. Molly, make that appointment. The initial consultation is complimentary, and that's really where you get a lot of your information and a lot of your questions answered when you sit down with Dr. Molly. Again, 856-489-0505. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And our show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Questions for Dr. Molly, and we always tell you this every week, and it happens. Call in early so you get your question in. We don't want to leave you shut out, but unfortunately, when you call at 8:57, that's what happens. All right, 855-839-1210 is our number here in the studio. I know you wanted to talk about insulin resistance and diabetes, and I know you have many patients, myself included, who are in this category.
Well, yeah, John, and here's the thing. The thing about it is it affects so many other things, and lots of people come in with a mixed bag, so to speak. You have diabetes, and then you have all the ravages of diabetes, including the heart condition and the vascular conditions and that kind of thing. But, I want to talk about when people say they have something like a touch of diabetes. And really what they're talking about is insulin resistance.
Okay.
Approximately 80% of the population of the U.S. has insulin resistance. And what that is the body is still producing insulin, meaning biochemically the body is still producing. And let's thank God, okay, that they are, because some people are born with the situation where they cannot produce any insulin, and lots of that is the juvenile diabetes, etc. And then they have adult diabetes as a result of that. But when the body is producing insulin, but it isn't sufficient, the body can't use or can utilize the insulin that is being produced. And so what happens is the body then tends to do what? It produces more glucose so that the body can compensate for this. So you start to see the rise in the hemoglobin A1C. And everybody says to me, oh, well, that's got to do with anemia. No. It's the tail on that, on the hemoglobin molecule that carries the insulin to every place, or the glucose to all of the organs that the organs need to process and do their job. But here are some of the symptoms of this. So what happens is that people really have the excessive thirst, just like you would with diabetes. They have the weight gain, right? But why does this happen? It's an interesting kind of situation, John, because excessive dieting can do this. There's people who are yo-yo dieters. I'm not talking about fasting now. I'm talking about yo-yo dieters.
We have plenty of them.
Oh, yeah. So do we have a call or something?
Yeah, we do have a call. Okay. We're going to talk to Nancy in Levittown. Nancy, good morning. You're on Health Watch with Dr. Molly.
Hi, Nancy.
Hi, how you doing? Good morning.
Good.
I love your show. I listen to it every Sunday.
Thank you.
I just want to see, do you know anything I could do for leg cramps at night?
Oh, my gosh, yes.
And
yes.
I'm on vitamins. I do yoga.
Which one?
I bowl.
What vitamins are you? Yeah.
Multi-C, fish oil, B-complex.
How about
calcium, magnesium, and zinc.
Okay,
And
good.
vitamin
I
D.
wanted to know if you were on the calcium, magnesium, and zinc. Yeah, there's some homeopathic remedies out there that you can use. Also, have you ever tried any of those?
No, I haven't. Mm-mm.
Oh yeah, well please call a good health food store and get a list of those. There are some homeopathic. It could just be it could very well be, well, it could be a few things. That's the thing. I don't want to just go and say, "Oh, you don't have a problem," because you may have a vascular problem as well. Have you had any problems with blood flow to your legs?
No, not yet. I mean,
Definitely not. What?
Yeah.
How old are you, honey?
I'll
62?
be 62 next month.
Ah, you're a baby.
Just going to say
Okay.
she's a child.
Yeah, she's a
I
baby
hope so,
compared
but I
to
don't know.
yeah, absolutely, compared to people that I see and compared to John and I.
That's right.
You're a baby. You could be our little baby sister. So here's the thing. Okay, here's the thing.
I bowl with senior citizens. I'm the baby of the league.
There you go. That
So,
sounds like you
they're
do
my
everything right.
inspiration, actually.
Yeah, so you're exercising, which is good. It'd be interesting, making sure that you're getting enough blood flow there as well. But there are some homeopathic remedies out there, and I would look at those. And I really can't give you the list of those on the radio, but because we use certain ones in our facility. But I would definitely tell you that there are some things you can do. But I also would tell you that it would be good to make sure that you're getting enough blood flow to your toes and feet, etc., because that can also cause some muscle cramping if they're not getting enough of the blood flow. So why don't you ask? Maybe your doctor could send you out for a Doppler study or something.
I was just going to ask if there's a test.
We would do that. We would absolutely do that, and it would be interesting to see. Any other condition you have at all? Do you have any conditions?
No,
Good.
I've been
God
good.
bless you.
I mean, like 2 years ago or 3 years ago, I had a sciatic.
Okay,
I had
well,
lost my job,
yeah.
and I was on my job on my feet,
Yeah, yeah.
move. Well, then I started sit.
Yeah, you got to get
But
going,
I'm
man.
a mover. I am
God
a mover,
bless
but
you.
then I did get rid of the sciatic. I
Good.
work on it, and
Good.
chiropractic, actually. I
Good.
did too,
Good.
so.
Good.
Well,
Good.
Nancy, good
Well,
luck with that. Good luck with that.
Yeah. All
Yeah,
right.
God
Thank
bless
very
you.
much.
Good luck.
Thanks for
honey.
the call.
Bye-bye.
Appreciate it.
Yeah, that's an interesting question because it can be a couple of conditions, but there are some homeopathics that work. Okay.
But you would recommend maybe getting the study?
I want to get a little better history. I mean,
Right.
it's so hard on the phone.
Yeah, this-
this is like a 2-minute, conversation, and that's why people should come in for the consultation, because regardless of the condition, we might be able to get a little more information in the 15 minutes that I sit with them and see if there is something. Because if it's a small situation where they just need some homeopathics, or maybe they have to increase the calcium, magnesium, but you got to be careful about all that, because listen, Goldilocks is what I preach every week, right?
Yeah.
Just right.
Okay.
So back to insulin resistance.
I was just going to ask you. You wanted to talk about orthomolecular approach. That's your approach,
Right.
What
For-
does
okay.
that mean
Well-
in regards to what we're talking about?
Well, first of all, what I hear most times is that people come in and say, well, I have a genetic reason for this. How many times do I tell people that your genes are only a part of what's going on in the body, that the epigenetics, the stuff we do outside, counts, right? It's your eating, it's your nutrition. What nutritional things? Do you abuse alcohol? And I said excessive dieting, lack of exercise. This young lady probably does not have insulin resistance. She's got another cause for this problem. But nonetheless, these are some of the things that I see. So yes, the orthomolecular approach is the hydration approach. And I see a lot of this by using, one of the things I do is we have a protocol for insulin resistance to tune up your own cells so they become less resistant to the insulin, open up and do their job, right?
Fascinating.
It is. Isn't that an interesting approach? And it's done by nutrition outside. We would help you with your nutrition and the vitamins and minerals you need outside. But your bag may include things like trace minerals, which chromium is one of them. Zinc, of course, is another. Magnesium is very, very important. We might use vitamin D, and it's an interesting thing about vitamin D. Everybody says vitamin D, vitamin D. Well, vitamin D is really a provitamin. It's not a true vitamin. And that means it's used to really effectuate the real vitamin D that the body makes. And that's the one Dr. Molly likes. That's why you always hear me say D3 plus K2.
Yes.
Have you heard us? And
Yes.
I wanted to say Dr. Barbara because she's like Dr. Barbara. In fact, Dr. Mark says he calls up and asks Barbara sometimes what has to be done, which we love. And, we have to look at these things. So these are important. Fatty acids, omega-3s. You'll hear us talk about that all the time. Vitamin E. How about L-carnitine, taurine? You've heard me say all these things, right? And what happens, we even might use some arginine for some people. But again, we may not use all of these for you. And there's reasons for that. For example, we might not use arginine if you're having some challenges with AFib. Okay, so here's where the real nuance of this comes in, John. We have to see what's contributing to
And that's why you always say every bag is different, every person is different.
There are basic protocol for
right.
this, but again, I'm going to sit with you initially, and you're gonna write out what you're allergic to and all these things. Have you ever seen our packet when you come in? It's pretty intense.
Pretty intense. Yeah,
right.
exactly.
I mean, we just don't throw you in the chair.
Yeah. But you were mentioning vitamin D and all the things you're mentioning. Nurse Barbara has told me to get, and I get it, and I take it all the time.
Right,
So,
but you also get your bag.
Exactly.
So isn't it interesting? You are what I call a multifaceted client, right?
Right.
Because we have several items that we need to check off on your list, right?
Yes.
We need to look at a orthomolecular level for many of your conditions, not just one.
Right.
Right? And then we got to prioritize.
So I'm a real challenge for.
Well, you're one of many.
Yeah.
I mean, you're not alone. You know what's interesting? Most people are not a one-horse race, right?
Right.
They come in and they think this is their problem. But when you really sit down and you start talking, you realize this is just the particular problem that they're having in this moment. It's just a culmination of many challenges earlier.
All right, we're coming up on our halfway point of the show, which means we have plenty of time to take your call. If you have a question for Dr. Molly, a medical challenge, or you just want to talk about a certain situation, feel free to call in, 855-839-1210. That's our number here, 855-839-1210. It's Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT, with Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates. I'm John DeMasi. We return more of today's Health Watch after these words. And we're back here on Health Watch. Innovative Medical Associates operators are standing by right now, and they will be there well after we leave you at 9 o'clock. And you can call them if you have a question, or, you're a little bashful, you don't want to come on the radio, you want to make an appointment. That's really where you're going to get a lot of your information. When you sit down with Dr. Molly, the initial consultation is complimentary. The number is 856-489-0505. 856-489-0505. It's Innovative Medical Associates, Marlton, New Jersey. And the website is innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. Our show is Health Watch, Sundays 8 till 9 here on Talk Radio 1210 WPHT. Let's go to the phones, talk to Robert in Clementon, New Jersey. Robert, good morning. You're on Health Watch with Dr. Molly.
Hey, Robert, how are you?
Okay, well, yes and no. Good morning, John, and good morning, Dr. Molly.
Hey, I don't like that. Yes and no. Come on.
Okay.
All right.
I am en route to teaching a fourth grade religious ed class, so
oh, God
I'm going
bless
to ask
you.
my question, thank you, and then hang up, not to be rude, but in general, the question is as follows. I was diagnosed with celiac disease about 6 years ago.
Wow.
Doing a pretty good job managing it on my own.
Good.
That is to say, I'm avoiding certain foods, but if I step over the line, then the nausea kicks in. And, of course, ultimately, there could be some damage to the small intestine.
Yes.
So as I am on my way, I'll listen to your advice and perhaps previous good results from other patients
with
celiac. All right. So
yeah, it's a condition that I have an extreme interest in. So thank you for the call, sir.
Yeah, Robert,
and God bless
and
you
good
in
luck
your work.
with that.
God
Good luck
bless
with
you
it,
in your
Robert.
work. Anyway, yeah, celiac. That's an interesting disease. You know, that's inflammatory of the GI tract. Now, you know, I have many, many patients who come in to me, and they do exactly like Robert. They follow the nutritional advice. They follow the game plan in terms of how they eat, but they still tend to have some problems. You know, I have an IV protocol for that not only includes the nutrition they need. Generally, they have inflammation. And this inflammation can show its ugly head at any time. I use a particular product, a actual pharmaceutical product along. You hear me tell you
Yes.
that it's never one-sided. A traditional pharmaceutical in tincture along with the IV treatments, and it tends to hold the patient very, very well. There's a lot of European data out there on this particular product. It is made by our particular compounding pharmacist for us in tincture. And why do I use tincture? And it's different than most of the other integrated physicians out there doing it because they don't want to be bothered with helping the patient titrate the right amount for them. You see?
Yeah.
They make it in one particular size and they give it to them. But we're talking very, very low dose. So is there a hope for this? You bet. And now, we can't get you back where you're eating all the foods that you were doing before. But we have people who cheat once in a while and still do well. So, yeah, call the office. Come in for the free consult. Then I can talk to you about the particular nutraceutical. In fact, I have a patient that I saw yesterday who's on it, and she's doing real well.
All right, Robert, good luck with that.
God bless you.
Let's go back to the phones. Tom is in Pennsburg. Tom,
Hi,
good
Tom.
morning. You're on with Dr. Molly.
Thanks for taking my call, Dr. Molly.
No worries.
I do my own water analysis, and I found out that moderately hard water with calcium and magnesium.
Okay.
And I was wondering if those two items are well received in the body just by drinking water alone.
Well, I would tell you that may not be the case. It would be interesting to see what your levels are. I mean, the World Health Organization, and if you do the research, you know that there are maximum levels and minimum levels of all the hard water metals that are in there and minerals, that kind of thing. If you're not having any trouble, Robert, are you having any kind of problems like maybe leg cramps or anything like that? I would then say supplement. But I found most people need to supplement trace minerals in addition to what they're taking in the water.
Okay, the other thing that showed up was a little bit of lithium. And
yeah, now we're cooking. And it's interesting you called right now because one of the things I want to talk about in the next segment is something I call a medical mystery, and it has to do with environmental medicine, something I also have an interest in. So, yeah, I think that's another issue. And there are chelators for all these things that we could probably talk about if you came in and chatted with me for that 15 minutes. I would love to talk to you, Robert. You're not that far from our office. Come on in for the free consult. You sound like a pretty intelligent guy.
All right, Tom.
Thank you.
Thank you for the
Thank
call.
you. That was a
Appreciate it.
nice call.
Yeah. Yeah. All right, so talk about this medical mystery.
Oh,
what
this is yeah, you know how I love.
Is this like a Dateline show?
No,
It's a
nothing,
mystery.
nothing like that. Yeah, this was a 40-year-old woman who came in, and she came in with joint pains in her hands, hair shedding in the shower, body pain all over that comes and goes, and extreme fatigue. Her primary doc, her primary provider, did do all the tests, the CBCs. He actually tested for rheumatoid. He tested for Lyme. He tested for inflammation. He tested for the viruses. Everything came back absolutely normal. But, I started thinking about this. And again, I'm a city girl, so I'm not used to well water. Okay?
Right,
All right.
right.
But from the environmental medicine point of view, I really wanted to look at this. She was taking ibuprofen heavily, and we tried to cut that back, the good doctor and I. And she felt like her symptoms just kept getting worse and worse and worse. She did take a good vitamin D3 supplement, but she didn't take it with the K2, which is something that we insisted she do. And of course, we went through all of her vitamins, the vitamins that she was taking at home. But, I started to think about this, and having the interest in being a member of the environmental medicine group, I decided to actually look at other things in her blood. They tested for heavy metals, but they didn't really test for arsenic. And arsenic in small amounts are allowed in our water, if you can believe this. Can you?
No, I can't.
Yeah, well, it's true. It's true. And what happened is, arsenic is removed from our bodies through a particular methylation avenue. In other words, there are particular biosynthesis that happens, and that's how the arsenic is removed. Now, I am not saying someone's poisoning her. Do you hear what I'm saying?
Yeah, right.
Okay. She tested within normal limits, but trifling higher. And so looking at that, we really started to think about what it is that was going on for her. And we realized we then checked her genetically for this MTHF. And don't you know she has it? So she has a dysregulation genetically on how to clear the arsenic. And that has probably been contributing to her joint pain. So we have her on a particular IV protocol that I'm doing that will include certain methylated or methylated B vitamins, and nothing like folic. We don't want her on anything that might contribute to worsening her condition. She's actually going to be on a protocol of B1, B2, B3, and B6, in addition to our good friend vitamin C and a particular chelator that I'm going to use to help get rid of a little bit of that arsenic.
So this is a multifaceted, complicated situation.
That you would say she has some arthritic. Why is she having the inflammation when she's doing everything right? She's having the inflammation because she has a dysregulation in the methylation process that the body uses to clear these kinds of minerals that might be in there too much. Also the things like arsenic and lead. These kinds of things are in our fluoride is another one. I mean, things are in our water that generally the body just clears out for us, which is why the powers to be let us have a certain amount without it being toxic.
Because it doesn't really affect you.
If you have certain genetic dysregulations, it will affect you. But that's going the extra mile. You would look at the testing and say, oh, she tests negative in most of this, so why does she still have the inflammation? Well, this is why. She has a genetic condition. So I thought that was an interesting case.
Yeah, it is a mystery, which
you
generally solve all the mysteries.
Well, I thank God. Now, I'll tell you something else she's going to need. She's going to need things like alpha lipoic, which is a precursor to glutathione. She's really going to need things that are going to help her liver, etc. So these genetic variations in the body really can cause our metabolism to be trifling different than someone else's. We know what the general metabolism is, and we assume that by running these regular tests, you're fine. But again, I'm going to tell you, it's not in your head. In this case, it wasn't a virus, but it's still not in her head.
Which you get many of these situations where they're complicated and complex problems and issues.
They're complex, but when you think about it, what is the universal? We all need to drink water,
yes,
right?
Yes.
So lots of these things are common in our drinking water, but if we don't have the right metabolic, right? If we're not perfect, let's say if we're not perfect by the standard, whatever that means, then you may have a problem. And it's not in your head. It's really happening. And there's a dysregulation on the gene code. Now, I'm not saying you should, that people, should knowingly be exposed to things. No, but there's a certain amount of exposure we're all going to have just living, John. That's the point.
All right, we're coming up on our final break of the morning, which means you still have time to jump in with a question at 855-839-1210. 855-839-1210 is the number here. It's Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT with Dr. Molly Fantasia, the PhD doctor, executive director, and founder of Innovative Medical Associates. I'm John DeMasi, coming back with more Health Watch after these words. And we're back here on Health Watch. Operators are standing by right now, and they will be there well after we leave you at 9 o'clock. In fact, they don't take a break for the Eagles or the Phillies game, so, just feel free to call at any time. 856-489-0505, 856-489-0505, Innovative Medical Associates, Marlton, New Jersey, and the website innovativemedicalassociates.com. innovativemedicalassociates.com is the website. Our show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Back to the phones we go. Debbie's in Bucks County. Debbie, good morning. You're on Health Watch with Dr. Molly.
Hi, Debbie. How are you?
Good morning. Okay, thank you. I just wanted to know your thoughts about the medication Prozac given for anxiety for someone that's like 19 years old.
Okay. So wait, now you're 19 years old, Debbie? Is that what you're telling me?
No, oh. I'm not. It's somebody that I know. Okay.
And they're being treated with the Prozac. Is the anxiety related to some depression? Do you know?
I would guess so.
Yeah.
I would think so.
I would think no one is just going to order and is it a gal or a gentleman?
It's a female.
Okay, good. So I think, are they being seen by a psychiatrist or the family doctor? I don't want to say just the family doctor because he's very important.
A psychiatrist.
Great. Okay. I'm a big believer in utilizing the psychiatric meds when needed. You know why? In 19, there's some hormonal issues going on for women that have to be looked at as well. But you don't want that depression because we all know that there's a lot more younger folks in a depressive state, especially because of COVID. I mean, I got to tell you, COVID's making everyone depressed. I'm surprised more of us aren't on the Prozac, right? But I think it would behoove this person to do a functional medicine consult as well, because there could be some underlying conditions that are adding to her problems. But I do not think it's a good idea to get off of these drugs very quickly. Sometimes they need to be used in certain situations because I would say that the depression is worse than the drug at this point, And is she getting out? So please, as Dr. Molly says, it's always Goldilocks. You use the least amount you need to medicate someone and maybe augment that with some treatments that we do, and then they can gradually bring the patient off. I've had success in helping some patients, younger patients, actually even older patients who were taking these antidepressants, and we were able to reduce the dose because there are some side effects like weight gain and things like that. But when you look at it overall, the antidepressants are very much needed, particularly when people are going through this thing when they feel isolated. So I would say yes, but there are also B vitamins, certain types of Bs that can be used, and certain amino acids that can be used in this case to help a patient who's undergoing this kind of problem. But again, it would really need a consult, and we have to sit down with the doc and talk about this. But I would not stop the medication. No, that's the truth. God bless you, dear. Go ahead.
Thank you. If they also struggle with maybe some signs of ADD, are there like natural supplements that you think?
Yes, absolutely. There's actually a brand new study out showing certain supplements for all these neurodegenerative type diseases, and I'm telling you, there are nutrients for anxiety and stress. I was just reading a particular study on that, And there are things using light therapy, which we use in our office actually for brain function. And it would be something I would use both for the ADD and also for the depression. So yeah, there are many things we can do. But I think the other thing is we should do a full hormone panel for these folks. So anyway, that's my thoughts on it.
Okay, Debbie.
Thank you.
Thank you very much.
God bless you, Debbie. That was a great call. Great
Yeah.
call. But again, my philosophy is what? Don't throw away your medication. Right. And in particularly these types of medications, John.
Question, though, in that particular case. Is 19 too young to be on Prozac?
I don't know, John. I don't think so. If you're depressed, listen, how many teenage suicides have we seen?
Too many.
Right. That's the worry. Brain chemistry is a funny thing. Now, I do have a referral to a gentleman in New York who does a lot of work with brain chemistry. We do plenty. We do a lot of the follow-up. But I would tell you that you don't just approach this like get off the meds because you have an inherent situation where you just don't like that particular med. I don't think we should do it, or that category of med. You really need to take a step back and know what is the universal good in that situation.
All right, we got a couple of minutes left of the show. I know you wanted to talk about our favorite subject, COVID.
COVID. Well, it's a funny thing. I just read another study, and actually, I've actually worked with the doc in our facility treating some people who had mild cases of COVID, or they had just early onset. And again, testing is important. I agree with that. But, it's an interesting thing. The hydrochloroquine that everybody is, who poo-poos it, who's talking about it. But there have been people who have been treated with this, it seems, successfully. And I actually have a study. And one of the things it does is it's a slow cytokine modulator, which means that it controls inflammation through modulation of interleukin-1, interleukin-6, and TNF, which is also an interleukin that contributes to inflammation. But using it with vitamin C has actually helped even more. So again, our philosophy was to utilize an IV treatment for COVID and post-COVID. And by the way, we are seeing more and more cases of post-COVID that are affecting hormones, both for men and women, besides just the respiratory, and also neuro. They're affecting people in endocrine issues.
And a lot of people have post-COVID issues that don't know about it.
That's right. That they think that they don't. They didn't think they had it, and then it turns out that they did. And then I'm seeing a lot of people who are coming to us now post the inoculations, and they believe they're having side effects to the inoculations, and not just in the respiratory, but feeling. I just treated someone yesterday who came in, and what we did was what we're doing is going after the inflammation. So that's really what we're doing. So
I noticed vitamin C comes into play again.
Vitamin C is the best pro-oxidant and antioxidant. It's because it's just a wondrous nutrient that God's given us.
Guess what? We're out of time.
All right.
How about that? That's going to put the wraps on another edition of Health Watch. Don't forget, you want to talk to Dr. Molly during the week, 856-489-0505. You can actually call right now and set up the appointment. The initial consultation is complimentary, and it's pretty easy. You'll get a lot of the information that you need, 856-489-0505. The website, innovativemedicalassociates.com. innovativemedicalassociates.com is the website. Don't forget, you want to pick up Dr. Molly's new book, God's Ingredients, TOO. My 30-year journey in IV nutritional medicine, available on Amazon.com or anywhere books are sold. God's Ingredients, TOO, My 30-Year Journey in IV Nutritional Medicine. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, Barbara, delightful Dee, fabulous Fran, we have Joanne and our nurses Jess and Crystal and our medical assistant caring Kathy. I'm your host, John DeMasi. Thanks for listening. Have a great week and a healthy one. We'll talk to you next Sunday. Health Watch, 8 till 9, Talk Radio 1210, WPHT. You take care.